I'm Dr. Keith Currie, and I'm outside of Fox 16, Channel 4, KRK in Little Rock, Arkansas. Today is January 22nd, 2021, and this is a patient of mine from Camden, Arkansas, named Tanner Skidmore, and he came all the way to Little Rock to do a TV commercial for me today so that patients could hear about what they needed to know about my clinic and what we do and how much it's helped Tanner. So Tanner, will you go ahead and just share with everybody what your experience has been and why you came to the clinic and anything that you just like to share that we couldn't get in on the commercial?
Okay. So back about 15 years ago, my dad dealt with ruptured discs, and I mean, he was in pain. You know, it probably, people have different pain tolerances than others, but I could tell he was in pain. And, you know, he couldn't hardly go to work. And when he did go to work, I remember him telling me he would have to lay on the floor and put his feet in his chair just to get some type of relief, you know, some type of relief from that pain in his lower back. He would even lay on the table where we eat lunch. He would have to lay down on some hard, flat surface to get some kind of relief. And I started having problems. I started having sciatica really bad about 3 years ago, but I've always had a high pain tolerance, so I just dealt with it. But then it finally got to where I couldn't handle it no more. And I remember the morning I woke up, October 26th. I woke up and I just almost couldn't move. I couldn't put my socks on. I could not tie my shoes. You know, anything that dealt with bending over, I couldn't do it. And you know, standing in the shower, you can't even take a shower like you want to because you're just hurrying. You just want to get to that next seat so you can sit down or you can lay down just to get some type of relief. But my dad, he used Dr. Currie 15 years ago, and my dad's not had any problems since. And he's 63 years old. I'm 23. It don't matter the age. You know, before you go have injections, before you try back surgery, my dad failed 2 back surgeries, and then he went to Dr. Currie, and no medication. You don't go through any medications. It's all natural. It's all you know. You have to drink your water. That's very important. But I 100% encourage people before they do anything else, try Dr. Currie if you have the time, because he helped me a lot. You know, I couldn't be the husband I wanted to be. But I would try to do the best I could, you know, just as much as I could, just to be some kind of help to my wife. And you know, she didn't really know the pain I was in because I've never been the type of person that if I'm hurting, I was really gonna let you know. You could tell by how I was walking around I was hurting, but I'm not gonna complain about it because then that affects your mood, and nobody wants that. So she never knew how bad I was hurting. She just knew I was hurting. But I've been to Dr. Currie. I did the treatments for just probably a week over a month. And, you know, drank my water like I was supposed to, did my stretches, wore my belt. And I'm standing here right now, and I promised 3 weeks ago I couldn't stand here without leaning up against the fence to get some relief or looking for the next seat. I'm standing here and I feel fantastic.
Thank you, Tanner. All right, so share with me what you were telling me about when you were a brand new patient, the 2.5-hour drive to Conway from Camden, how that was at the beginning.
Okay, so in the mornings is when I would hurt the worst, when I'd wake up. And the only way I was able to sleep is to take some kind of sleeping pill. And I would even wake up in the middle of the night and take another pill. It was just that bad. And I had 2 ruptured discs, 1 bulging on my sciatic nerve. And anyway, I'd wake up on Monday mornings early to drive to the treatments. And I just about couldn't handle driving. You know, it's about 2.5 hours from my house to Dr. Currie's office. Well, I just about couldn't handle that drive. I would even have to pull over, stop, lean my seat back to get some kind of relief, and then I'd start back on my driving. It was that bad. But the very first day that I had my treatment, I got in a truck and I drove to my sister's about 30 minutes away. I was staying with her through the week. But I got in the truck and I immediately noticed that I could drive and not hurt as bad. I could actually put my foot on the gas pedal and it not just send a sharp pain to my lower back that quick. You know, it's absolutely amazing the type that what Dr. Currie can do.
All right, buddy. Thank you. And let's talk about what you were telling me about your shoes, putting them on and off, your dress shoes and everything.
So the work that I'm in, I dress up every day, slacks and button downs and a tie. Well, I couldn't tie my dress shoes. I could not bend over and tie my dress shoes. I couldn't even put my foot up on something and just slightly bend over to tie the shoe. So what I would do is I would just slip my shoes off at the end of the day with them still tied. I'd just slip them off and put them to the side, and then when I woke up the next day, I just slip them right back on, so I didn't have to tie them. But now I could, you know, I could tie my shoes standing here and bend over and have absolutely no kind of problem. I mean, it's amazing. You know, I'm here to tell you that he helped me, and you could ask any of my friends. You could ask Dr. Currie himself. When you walk into that clinic, he knows you're in pain. You know, I didn't make that 2.5 hour drive some weeks, Monday through Wednesday, every day, turn around and come back home. I didn't make that drive for nothing. You know, he helped me. He helped me.
Thank you, buddy. Thank you. God bless you.
Yeah.